And now tonight to the latest on the deadly coronavirus from China.
A local hospital in New Jersey just confirming moments ago that a patient there does not have the infectious disease after concern it had reached our area. CBS 2's Jessica Layton live in Hackensack with the story. Jessica.
Maurice and Christine, all this developing right now, a big scare and a big relief at this moment, because a couple of hours ago when we asked both the hospital and the New Jersey State Health Department if a patient who'd been brought here tonight was being tested for coronavirus, the answer was vague and they weren't saying no. Now we know that patient brought here tonight does not have coronavirus, but this is all just going to show all of us all the fear there is surrounding this illness right now and how prepared our local agencies are to deal with it if it does come here. The local concern follows days of worry after the outbreak began in the Chinese city of Wuhan, prompting police there to barricade roads, block access to trains, and patrol the airport. In fact, China's lockdown now encompasses more than 20.5 million people as it attempts to contain the spread of the respiratory illness that so far has sickened 830 people and killed 25. Most cases are in China, where Lunar New Year events are being canceled, but the virus is in 7 other countries: Thailand, Vietnam, Singapore, Japan, South Korea, Taiwan, and the United States. A man in Washington state has been quarantined after testing positive for coronavirus this week. There's a possible case in LA, and Thursday we learned a Texas A&M University student may also be infected.
The patient had traveled to the area of concern, developed mild symptoms after returning, and then again was improving and doing well. But the patient is in isolation.
In serious cases, the virus can cause pneumonia and kidney failure. Sarah Henry of the Museum of the City of New York has studied the history of how the area handles epidemics.
The systems of detection and quarantine and containment at the points of entry is really, really important.
JFK has been screening passengers coming in from Wuhan for almost a week. Henry believes if coronavirus were to show up in New York, the city is ready.
New York has a very robust public health system. So emergency protocols, an incredible system of hospitals, both private and public, and an incredible amount of medical knowledge.
And with that, New York City Mayor Bill de Blasio tomorrow morning will be meeting with local health officials, the NYPD and the FDNY to talk about the city's emergency response plan just in case the virus does land in New York City. Here in New Jersey tonight, a good test run of the emergency protocols, those infection protocols that hospitals across the country are practicing right now. But we are happy to be able to say the patient brought here to Hackensack tonight does not have coronavirus. We're live in Hackensack, New Jersey. Jessica Layton, CBS 2 News.